is a detailed, structured, and comprehensive explanation of the varicella chickenpox vaccine. Generic name, drug class, drug forms, brand name. Generic name, varicella virus vaccine, live attenuated. Drug class, live attenuated viral vaccine. Dosage forms, lyophilized powder for subcutaneous injection, reconstituted with diluent before administration. Brand names, Varivax, monovalent varicella vaccine, Proquad, MMRV, measles, mumps, rubella, and varicella combination vaccine. 2. Definition. The varicella vaccine is a live attenuated vaccine designed to protect against varicella-zoster virus VZV, the causative agent of chickenpox. It is administered to induce immunity, prevent infection, or reduce the severity of illness upon exposure. Mechanism of action. Contains live weakened varicella-zoster virus, Oka-Merck strain. Upon injection, the body recognizes the virus as foreign and initiates an immune response. Humoral immunity. Production of varicella-specific antibodies, IgG. Cell-mediated immunity. Activation of T cells against VZV. This memory prepares the immune system to quickly neutralize the virus upon future exposure. Prevents both primary infection, chickenpox, and reactivation, shingles, later in life. 4. Uses prevention of primary varicella infection, chickenpox. Reducing complications like pneumonia, encephalitis, or bacterial superinfection. Community-level protection, herd immunity. Sometimes used for post-exposure prophylaxis in certain scenarios if given within 3 to 5 days of exposure. Indications. Children aged 12 months and older without evidence of immunity. Adolescents and adults without immunity or prior vaccination. Healthcare workers, teachers, military personnel, international travelers, and others at higher risk. Non-pregnant women of childbearing age without immunity. Post-exposure prophylaxis for high-risk individuals. Number 6. Contraindications. Do not administer the vaccine in the following conditions. 1. Known hypersensitivity to any vaccine component, e.g. gelatin neomycin. 2. Pregnancy. Risk of fetal varicella infection. 3. Immunocompromised conditions, including HIV/AIDS with CD4 count 200 mmHg, active leukemia or lymphoma, receiving high-dose corticosteroids or chemotherapy. 4. Untreated tuberculosis. 5. Recent receipt of blood products or immunoglobulin. Wait 3-11 months, depending on product. Number 7. Before taking this medicine, precautions. Inform your healthcare provider if you are immunocompromised, have active febrile illness, have received immunoglobulin or a blood transfusion recently, are pregnant or trying to conceive, have a history of seizures or neurologic disorders, have been recently vaccinated with another live vaccine, e.g. MMR. 8. How to use. Route, subcutaneous SC injection. Site, children, anterolateral thigh. Older children, adults, upper outer arm, deltoid region. Reconstitution must be reconstituted with supplied diluent and used immediately within 30 minutes. Administration performed by trained healthcare personnel in a clinical setting. Number 9. Dosing information. Children. First dose, 12 to 15 months. Second dose, 4 to 6 years. Can be given 3 months after first dose if needed. Adolescents, 13 years, and adults, 2 doses separated by 4 to 8 weeks. Post-exposure prophylaxis. A single dose within 3 to 5 days of exposure may prevent or lessen severity of chickenpox. Number 10. Missed dose, overdose. Missed dose. Take the missed dose as soon as possible. If the second dose is overdue, no need to restart. Just administer the missed dose. Overdose. Rare and unlikely due to healthcare administration. No specific antidote. Monitor for signs of adverse reactions like rash, fever, or seizures. Number 11. Stop or avoid taking. If you develop a severe allergic reaction to the first dose, you become pregnant after receiving the first dose, you are diagnosed with a serious immunocompromising condition, you have active untreated tuberculosis. 12 side effects in detail: common, mild, pain, redness, swelling at injection site, low-grade fever, mild varicella-like rash, 1 to 3% of recipients, irritability in children. Moderate febrile seizures, more common with MMRV combination, joint pain, mild lymphadenopathy. Rare but serious, anaphylaxis, encephalitis or cerebellar ataxia, pneumonia, thrombocytopenia, low platelet count, herpes zoster, shingles. Very rare. Open quote, note, risk of serious complications is much higher with natural varicella infection than with the vaccine. Close quote. Number 13. Vital information. Store at 15 degrees Celsius or colder until reconstitution. Avoid contact with pregnant women or immunocompromised individuals if a rash develops. Pregnancy should be avoided for at least 1 month post-vaccination. Avoid use of salicylates aspirin for 6 weeks after vaccination due to risk of Ray's syndrome. Vaccine effectiveness is about 85% after 1 dose, 98% after 2 doses. Number 4, other drugs. Will affect certain medications, may interfere with the effectiveness or increase the risk of side effects. Drugs that may interact. 1. Antivirals, e.g. acyclovir, valacyclovir, famciclovir. Avoid 24 hours before and up to 14 days after vaccination. 2. Immunosuppressants, corticosteroids, prednisone, chemotherapy, transplant meds. 3. Immune globulin blood products, can interfere with immune response. Spacing of months is required. 4. Live vaccines, MMR, must be given the same day or at least 28 days apart. 5. High-dose radiation therapy may suppress immune response. Thank you. Have a nice day.